Thanks for joining us again at H360 Health Talk. We're back with a friend of Healthy 360, former employee, but advocate nonetheless for cancer patients. In fact, all patients and caregivers, Courtland Long. Well, Courtland, thanks for hanging around for part two.
My pleasure.
So part one, we talked about you being an advocate. We talked about self-exams and the importance of that. We talked about your diagnosis and what you went through in terms of getting to that diagnosis and the process with your OBGYN. And we kind of left off talking about your OBGYN recommending two surgeons for you to choose from. And I want to take and peel the onion back a little bit, because what I'm interested in talking about now is, what was your process for selecting the surgeon that you selected? You had two great institutions right here in New York City.
Yep.
Both could have done the job well. When you went in for the interview and knowing you were ultra prepared, so what was your process? And everybody, I think, has a little bit of a different process when they go through this. Take me through what your approach was. How were you going to go from 2 to 1?
Well, speaking of being prepared, I have to give our good friend Dr. Sophie credit here, because after getting the diagnosis and having the two surgeons that I now needed to vet, I called her or emailed her and, said, hey, kind of a shocker, but here's my new world situation. Do you, I know we always talk about being prepared, going in with a list of questions. Do you have some suggestions of maybe what I should ask or things I should be aware of? And she was great. She called me up immediately. You were sitting right there, and she went over targeted therapies, the different kinds of radiation that you can have, and some of these things were a little bit advanced for where I was in the stage of picking a physician, but it did give me a lot of really great things to talk with them about. So the thing that really stood out to me was that the surgeon that I ultimately went with for my treatment was super patient. I had all these questions that were, we just weren't ready to be discussing those things yet, but I still wanted to know because it takes a while to process some of this information. So she was very patient. She took me through, what it means to have breast cancer. She drew me little diagrams. She answered my questions, answered my friends' questions. Just was great and chipper, bubbly, very positive. And, being positive throughout this process is also very important, I think, for sometimes your survival and your mental health. Whereas the second surgeon that I interviewed was a little bit dismissive, was not very patient with my questions. She was answering phone calls in the middle of our consultation. So ultimately, I knew she was not going to be the right fit for me.
Yeah. So a couple things. One, what was your formal diagnosis? Because breast cancer isn't breast cancer isn't breast cancer. There's different types of breast cancer. What was your formal diagnosis?
Yeah, I was very lucky in that I only had stage 1, but I have stage 1 triple negative breast cancer. So that was very important when discussing my treatment, because all these targeted therapies that we hear about today are targeted for the hormonal kinds of cancer, and triple negative means that it is not positive for any of the hormone receptors. And it's a bit of a more aggressive type of cancer, so you kind of have to keep all that in mind when you're thinking about your treatment plan.
You mentioned something else. You mentioned that the surgeons answered your questions as well as your friends' questions. Tell me about that. Who was your friend? You don't have to name your friend by name if you don't want to, or we can just keep it to first names. And what was the purpose of your friend being there?
Yeah, well, I took my friend Marissa with me. She knew about everything from the beginning, and she's a very stable person. So I knew that she would also kind of do some of her own research and come to the table with some questions that maybe I wasn't thinking about just yet. So for instance, Marissa knows that it's very important for me one day to have the potential to be able to have a family. And so she was the first one who started asking questions about fertility preservation, which is a very important thing to keep in mind if you are a young adult with cancer and you don't yet have a family. So, you know, she was great. She was a total rock and came in well prepared. And Dr. Heert at MSK was very patient, answering both of our questions.
So Memorial Sloan Kettering, which is where you went for treatment, tell me about their process as an institution. So you get there, you meet the surgeon, but it's my understanding from talking to other people that have gone through the system at MSK, whether it be for cancer or something else, that they've really got the process fine-tuned.
Oh, they sure do. They know where you are in the building every moment of the day. They know, like, if you're not there, they call you up and, you know, figure out where you are on the days for your treatment. You know, they're not, like, spying on you. But, yeah, they're great. They kind of, there's so many questions, concerns that go through your mind when you're going through this treatment and everything. So they kind of take all that burden away from you, you know, rather than being on top of all of your appointments, they are on it. They have an app that is really helpful in managing your medications, your appointments, your, you know, lab results or anything. So they definitely have it down.
They've done this once or twice.
Yeah.
So let's talk about, okay, so we're at the point now where we settle on the surgeon, and it's MSK, and you've got your physician, and she sits you down and she says, okay, here's the game plan. Here's what we're going to do. Take me through the game plan. What's first? What's second? What's third?
So she actually didn't sit me down and say, here's the game plan. She sat me down and she said, here are our options. You know, I want to be respectful of your life and, you know, what you want to do. You can choose to have chemotherapy before you have your surgery, and here are the benefits of that, here are the negatives of that, or you can choose to have your surgery first and then your chemotherapy and then your radiation, and here are the benefits of that and the negatives. And so she really outlined everything very well, and, you know, let me make the decision of how I wanted everything to go. So ultimately I decided to do my chemotherapy first because I knew that the purpose of chemo is to shrink the tumor, and so I figured, you know, the smaller the tumor is, the less disfiguring potentially the lumpectomy would be. And, you know, everything worked out well, and then we did radiation, and now I'm just finishing up with some oral chemo.
So let's go back to the chemo. So what was the chemo regimen that you went through?
Yeah. I was on a couple different chemos. It's commonly known as ACT. It's adriamycin, Cytoxan, and Taxol. The A and the C are given together. One of them is a bright red medication, and comes out that way too. And and they push that in manually. It's a very toxic medication, so they need to be able to observe it the whole time that it's going into your body. And then the Cytoxan is just a bag that they hang, and then that's 4 cycles, and then the last 4 cycles is just straight up Taxol, which actually a lot of people can have allergic reactions to, so they give you a ton of Benadryl. So you pretty much just nap for 4 hours when you're getting that infusion done.
So when you go the first medication, the push medication, how long does that take?
That it's pretty quick. It takes probably about 10 or 15 minutes, and then the Cytoxan and all the steroids and saline that they pump through you as well, I think that's also about a 3 to 4 hour long infusion. So it's great to have friends there. You can order food in, you can watch television, you can work, you can read, do whatever you want to do. They're very accommodating.
Now, when I had my hip replaced, I had a friend bring me a bottle of wine the day of my surgery.
Who could that have been?
I don't know. A couple hours after my surgery with some Afghani food, which was wonderful. I take it that's not allowed when you're in chemo to order in. It's Afghan wine.
Yeah.
I'm just guessing.
Yeah, well, they do recommend that you don't drink very much, if at all, when you're going through chemotherapy, because your body needs to metabolize the chemo out. And it's very taxing on your body, and it can cause some liver damage.
Now, when you're being infused with this chemo, do you feel a sensation? Do you feel a burn in your arm or a tingling, or is there any sensation as you're sitting there in the chemo chair?
It's more of like a cold flush that goes up your arm. And they can do, there's so many sites on your arm. It doesn't always have to be the crook of your elbow. I one time had an IV line placed in my hand. I've had it placed here in my wrist. I've had it placed just like on my forearm. And it just feels like a simple cold rush that goes through your arm.
So now you decided to cut your hair before you lost your hair, right? I mean, and I think the doctor may have said to you that, look, you're probably going to lose your hair.
Oh, she said you are going to lose your hair.
There's no ifs, ands, or buts,
it's
right?
It's happening. Mm-hmm.
So you decide that you're gonna, as you always do, you're gonna be proactive, right? And you're gonna cut your hair, and so let's lift it up a little bit. Tell me about that day. You go into your beauty salon and you go, "Hey guys, I'm here," and "Hey Courtland," right? You've been going there forever, and you say, "We're going to change it up today. Let me tell you what we're going to do." How did that go?
It went great. You know, I can't stress enough how lucky I am to have so many great people in my life. Allie, who is my stylist at High Horse Salon in Williamsburg, I think that I had talked to her about it well before. And so when my oncologist sat me down and said, "Your hair is going away," and that was all I needed to just be like, "Okay, fine, we'll chop it off, donate it, and then when it comes time, we'll buzz it and it'll look cool." So I go in, I chose the charity that I wanted to donate my hair to. I donated it to children with hair loss. They make wigs for kids who have alopecia or going through cancer or anything like that. And so she, put it in some ponytails and cut it off. And everyone in the salon was very supportive, and they all had questions, and they all wanted to know, like, "Oh my God, how did you find out? What are you doing?" And so I appreciated that also became a chance to educate other people about, you can be young and get cancer. It's not an old person's disease anymore.
Yeah.
So that wound up being a good day.
So that everybody at the High Pony was pretty good.
High Horse.
High Horse in Williamsburg.
Yeah, they were
so
great.
Shout out to them, obviously, right?
Mm-hmm.
So, and I'm so glad you donated your hair. That's some child is walking around with a beautiful wig right now, I have to say, because you had gorgeous hair.
Thank you.
So we talked about the chemo and the chemo chair and what that felt like. And then the second part of the journey was the surgery, correct?
Mm-hmm.
And so tell me, what was it like prepping for that? Was there any prep for the surgery, and how did that go? What was the day of the surgery like?
Yeah, the prep is fairly extensive, because I'm sure, as you know, when you're having surgery, they don't want you to have any sort of blood thinners in your body, and there are some supplements that can also act as blood thinners, like fish oil. So there's 60 days out, you have to stop taking any supplements, and then 30 days out, you have to do this. And they give you a whole packet of all these milestones that you have to meet. And then there's also another app that they have specifically for the surgical center. I had to go in and have a couple days before the surgery, I had to go into the surgical center and have a radioactive seed placed in the tumor, near the tumor, and a couple more images taken. And the radioactive seed is done so that, the surgeon can find exactly where the lumpectomy is and they don't have to root around in there anymore. And then I also had to have some dye placed in my lymph nodes because they did a sentinel node biopsy, which is they just take a couple of your, first lymph nodes out from your armpit, because if the cancer spreads to your lymph nodes, those are the first ones that are going to be affected. And so that's how they're able to tell if they need to take out all the rest of the lymph nodes in your arm, which thankfully I did not need to have that done.
So you show up, now surgery was at Memorial Sloan Kettering?
Mm-hmm.
So you show up day of surgery.
Yeah.
What was that like? You check yourself in.
Mm-hmm.
Family with you, friends with you. What was the scene there?
Well, my parents flew in from Illinois, and then my brother Casey, who lives with me, he came to the surgery center with me. And I mean, you think the cancer center is a machine? The surgical center it just blows your mind.
I thought you were going to say the Long family was a machine.
No, they were great. They were, very, I think because Dr. Heert was wonderful with them and took time to answer their questions. Our mom is a nurse, and so she has all these questions too. And even though Dr. Heert had 15 surgeries she was doing that day, you would have thought I was her only patient because she sat there and, chatted with us and was very calm and collected. But you walk in to the surgery center and immediately they put a little tracker on you. It kind of looks like a pager. And there's a giant board in the waiting room that has everyone color coded as to where they are, if they're in pre-surgery, if they're in surgery, if they're in, wherever they put you when you're waking up from the anesthesia. So your family knows every second where you are. There's no, questioning anything. And I think that gives people a lot of peace of mind.
I think you're right. Just making them part of the journey and letting them understand and seeing you move from step to step provide some level of comfort.
Yeah.
So you wake up out of surgery and you're there recuperating. Your physician comes in and says, "Good news, everything went well." And then what's the recovery from there? Was it an overnight stay or a couple of nights stay in the hospital before you go home?
Nope. I went home that afternoon. I only had a small lumpectomy, so I'm not sure if women who have mastectomies have to stay any longer. But we were able to go home to my apartment in Brooklyn. Casey was kind enough to grill us up some dinner, and we just kind of hung out and had a party. I know my parents were a little concerned that just having had surgery, would I be up for it and everything. And some friends came over, and what I said was, look, we're in my apartment. If I'm tired or if I'm not feeling well, I can go to bed and you all can keep hanging out. So, it's not like we're out at a restaurant or anything like that. Yeah. But
it's the open door policy, right?
Yeah. The recovery was pretty quick. The stitches are self-dissolving,
right,
so you don't really have to, she just wants you to come in and take a look at it, make sure you don't get an infection. They tell you about things to look out for in case you develop a hematoma or an infection. I did not. I actually didn't even really need to take any of the pain pills from the surgery. Everything was very manageable with just Tylenol.
Great.
Yeah.
So now surgery's over and we're entering the last stage of the treatment plan, which is the oral chemo.
Well, I had the surgery and then I had radiation.
Oh, that's right. Sorry, I forgot that step.
That's okay.
Okay, so radiation. So you recover from surgery, and then how long after surgery before your first radiation treatment?
It was, I think, about 6 months.
That long?
I think it was a little while. They want you to be fully recovered, everything healed up. Well, maybe it was like 3 months. I kind of forget. But radiation was a month. You have to go in every Monday through Friday. I scheduled all of my radiation appointments very early in the morning, which seemed like a great idea at the time. But, one of the major side effects of radiation is that it makes you very tired.
Mm-hmm.
And I had known that, but I don't think I really
appreciated
understood.
Yeah.
Like, there's many different kinds of tired. And the radiation fatigue is, something where it doesn't matter how much you nap, you're just tired, and it does kind of affect your day. For me, that was the hardest part of the whole treatment regimen, was the fatigue. I'm a very go kind of person.
Yep.
So having to just kind of like take a moment to chill out was tough for me.
Yeah.
Mm-hmm.
So how many bouts of radiation?
I want to say it was something like 20 or 25. It was a full month of Monday through Friday, or possibly it was 30 days. But it was not as long as some people have to go for, but it was enough for me.
So what are they trying to get at in the radiation? The lump is gone.
Yeah.
Right, the surgeon has taken the lump out.
Mm-hmm.
So what's the purpose of the radiation?
Well, I'm not a doctor, so don't, take this
and
too
I'm
much.
one online class away from being it, so between the two of us.
Yeah.
Right?
We got it.
Yeah.
It's my understanding that the radiation changes the cells in a way that hopefully any kind of microscopic cancer that is left over will not continue to grow, and will just kind of shrivel up and die. But I would ask an actual doctor about that.
So radiation, you go in, you lay completely still.
Mm-hmm.
How long does the process actually take is it a zap and that's it, or is it longer than that?
It's very fast. I would be in and out in under 10 minutes.
Oh.
They do tell you to plan for about an hour to be there, but I think because mine were like literally the first appointment of the day, there was no delay just yet. So it's very precise. They don't want to be just radiating you any old where.
Sure.
So sometimes, you have to go in for an appointment, for a couple appointments before, where they get you exactly positioned, how they're going to want you on the table. In my case, they gave me some tattoos to mark where they were going to be zapping me. Some people, they'll take a mold of your back of how you're laying, and then you lay on that every time. But as soon as they get you positioned, it's literally like boom, 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 and you're out.
So, and then the final step is the oral chemo.
Mm-hmm.
And tell me what that's like.
So I'm taking about 6 months of Xeloda or capecitabine. They're the same thing. And it's just, 4 pills in the morning, 4 pills in the evening. They did step me down in dose one time because the side effects of Xeloda are not fantastic. And
in terms of
it can cause GI issues. It causes very dry skin on your palms of your hands and the soles of your feet. So it sounds terribly disgusting, and I'm so sorry, but the skin on my feet was literally coming off in sheets. And, they tell you to put Eucerin on, Vaseline, whatever at night, just moisturizing all the time, which I already am a freak about moisturizing. So they did step me down in dose because I was developing a lot of blisters on the bottom of my feet, and it was painful to walk. It can cause leaky eyes. It can cause nosebleeds. It causes really bad chemo brain. It causes like vertigo, so sometimes I lose my balance.
So chemo brain is a real thing.
Oh yeah.
And
very
it's
real.
just short-term memory loss, or did I do this, or is there one chemo brain incident that comes to mind that you go, whoa, that's chemo brain?
Yeah, certainly sometimes it's kind of like short-term memory loss. For instance, I'll be like working on a document and I'll come back to it 5 or 10 minutes later and I'm like, what did I put in here? I don't remember writing that. It doesn't make any sense. Or sometimes even just like having a conversation can be hard because you're struggling to recall certain words or what you did the other week. It's a little frustrating.
So I have to ask you this. Let's take a step back to the beginning of the journey of the treatment. Mm-hmm. Did insurance play a role in your decision making on your treatment plan? Did you look at insurance? Did you call insurance and say, hey, I've just been diagnosed with breast cancer and here's what I'm facing and what do I have to do? There's so many people that we talk to, and you'll remember this from being here with me, that reach out to us and say, I can't afford my treatment. Mm-hmm. And was that a consideration, or did you look into it, or you just said, you know what, I'm going to go forward and I'm going to figure that part out later?
Yeah, I did look into our insurance. I called up our woman who manages the insurance company and asked her a bunch of questions about, what's covered, what's going to be the cost, because we have heard many stories of people going bankrupt because they are trying to afford cancer treatment. It is very expensive. One medication that I would have to take after every single IV chemo treatment was $10,000. A $10,000 injection 8 times, there's no way I could have afforded that. So I looked at foundations that provided grants to patients and caregivers. Unfortunately, I did not meet the financial requirements for that. However, luckily enough, Memorial Sloan Kettering has a financial assistance program that I qualified for. So again, I'm so lucky, very fortunate to have these resources because all of my treatment was free through MSK because I qualified for this financial assistance. All of my fertility preservation was free because I qualified for a grant through the Livestrong Fertility Foundation. The only thing I had to pay for in that process was the anesthesiologist during the egg harvesting. So there are resources out there. You just really have to look for them. Sometimes it can be hard, but your local cancer treatment center may have a great program that you could qualify for.
Yeah, excellent point. So what does the journey look like from here? You're going to be finishing up oral chemo soon. Mm-hmm. And then what's the regimen here on out?
The regimen is that I will have every 6 months either a breast MRI or a mammogram for 5 years, because most cancers have about a 5-year survival rate as to whether or not you're going to be in the clear or if it comes back. So it's going to be about 4.5 years of watching and waiting, getting some pictures taken every 6 months. And I did already have my first mammogram after everything, and it came back clear. So awesome. Holding out hope that my MRI will do the same, and for the next couple of years.
Awesome.
Yeah.
So Courtland, what would you tell other young women who are diagnosed with breast cancer or another type of cancer? What would be your advice to them?
Well, everyone's different, but I would say don't let this control you. It's very important to remember that you have options. If you don't like what you're getting someplace, go to another place. It's so important to feel positive about your support groups, your treatment plan, your medical team. And if you're not feeling good about those things, then it's not right for you. So I think it's really important for people to remember they can still live a happy, active, fulfilling life while going through this not super fun journey. But there are things you can do that will make it a little better.
Yeah. You know, so many times you and I have sat down with people that are going through the journey or have been through the cancer journey, and oftentimes we hear them say that cancer, oddly enough, has changed their life for the better, going through cancer. Do you feel that way?
That is a really good question. I don't know if I would say it's necessarily changed my life for the better or for the worse, but I would say that it has given me a great appreciation for the work that we've done with the patients and caregivers, and knowing that Healthy h360 touches so many families who need help. It's definitely made me appreciate all that work so much better.
The other thing that people say to us, and this is more on the family and friends side of the equation, that I don't know what to say to somebody, to a friend who's been diagnosed with cancer. I don't know what words to use. I don't know how to approach them. And sometimes those people kind of take a step back from a friendship relationship because it's not that they don't love you any more or any less. It's just they're confused themselves. What advice would you give somebody when their friend or a loved one has been diagnosed with cancer? What are some of the, you now being in this position of having gone through it, what are maybe some of the do's and don'ts when you try to approach the conversation or talk to somebody that's been diagnosed with cancer?
That's a really good question. I think I would say just treat them like the friend that they have always been to you. They're still whoever they are to you, and yeah, they're going through a hard time, but I don't think that I was necessarily much different. I still tried to live my life as normally as possible, and so it was helpful to me when my friends and family just treated me like the same old Courtland they always knew. So I think keeping that in mind, and also being a little bit compassionate. I mean, don't baby them, but understand that just because someone maybe isn't complaining about having pain or fatigue or some other side effect doesn't mean it's not happening.
Well, as somebody that's seen you in total action, I will say you do know how to live life. Courtland, one last thing.
Mm-hmm.
If you could sum up the cancer journey in just one word, I know this is going to be tough for you. One word. What would that word be?
For my specific journey, I think the word I would use is successful. Whether it's a 5-year successful rate or it's getting people to take their health more seriously or getting my family to talk about things a little more, I think all of those can be counted as a success.
Well, Courtland, you're a beautiful woman with a beautiful story. And, that's H360 HealthTalk.